cure Alzheimer's, but some can slow down the progression of the patient's symptoms. And so what happens is there are cholinesterase, I'm not exactly sure how to say it, but they stop an important chemical called acetylcholine from being removed from the brain, and basically this is a neurotransmitter, and so it's helping it stay there. And so this drug only is prescribed for people in the early to middle stages, because after a year it usually doesn't work, and the disease has progressed so much that there's no way to help it. It's just going to keep moving on. So another big one is memory joggers, and they do this at the nursing home that I volunteer at. They have an Alzheimer's facility, and they just do like games that would jog their memory. So they have like to-do lists, photographs of themselves, and they would label like who the people are in the photographs. They have journals. Another example for a journal is like in the Notebook. How many of you have seen the Notebook? When Noah tries to make Allie remember their love, he reads her the story every day. And she remembers, but there's to a certain point, because dementia is, you can't stop it. But that is another big one too. So, yeah. So, activity time. I want you guys to get a partner, and I want you to ask them these 5 questions or tasks that a fully functioning brain should be able to answer or perform on the spot. And then I'm going to ask a volunteer to do them for me, and we'll see how well they respond, how fast. So I'll give you guys a couple minutes to do that with your partners. Who's older? What day of the week is it? Come back from 20 to 1. Friday. What's the name of our person? What is your name?
Donald Trump.
Are we good? Okay, can I have a volunteer? Okay, Chris. Okay, so how old are you, first of all?
I'm 17.
Okay. What day of the week is it?
Friday.
Okay, hesitation there. What is the name of our current president?
Barack Obama.
Yes. Count back from 20 to 1.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good job. Okay, now add 2 plus 3.
5.
Okay, very good. So this is like a simple test that they would give somebody who they thought may have Alzheimer's, and they wouldn't be able to answer these. They would get really confused, like what day of the week is it? They would have to really think about that, and they would probably get it wrong. So, yeah, I'm just be happy that you all can do that. So thank you for your time. Are there any questions? Anybody? Yeah.
What interested you in picking Alzheimer's as your topic for Bio Expo?
It's a very good question. Because my grandma has it, and she's always been a really funny lady, and what I've noticed is, even though she has a disease, she keeps a really good attitude. Like, she knows, too, that she has it, that she's forgetting things, but she just keeps her sense of humor, and I've seen that in a lot of elderly people, because I like to volunteer with them, and it's just, it's nice. So I learned a lot. I wanted to really understand the disease more, so next time I go see her, I can understand like what she's going through. So. Chris?
Do you see a cure for Alzheimer's in the near future?
I think there will be. Something that I didn't get into was also stem cell research, and that's a big one just because, you know, they could hopefully like regenerate the cells. But another big one too is also if they can stop the plaques and the tangles, then, you know, there wouldn't be cells dying. So I see a cure eventually, but it's hard because Alzheimer's progresses really slow, and so in order for them to test on somebody, it takes years and years, and so it's really hard to get the information that you need. So it definitely takes a while.